The Ebola outbreak nobody is talking about. You wake up with a fever. Nothing unusual. Maybe it's the flu. Maybe just exhaustion. You take some medicine, lie down, and wait. But within 48 hours, your muscles feel like they're tearing from the inside. Your head is splitting. Your eyes have turned red. By day 4, your organs begin shutting down. Doctors rush into full protective suits just to enter your room. And everyone who touched you before the diagnosis, every family member, every nurse, every person who sat near you on the bus, is now being tracked down. Because every single one of them could be next. This is not a movie. Right now, in 2026, this is happening. On May 15, 2026, the Democratic Republic of Congo confirmed its 17th Ebola outbreak since the virus was first discovered. 2 days later, the World Health Organization declared it a public health emergency of international concern, the highest alert level they can issue. Within 24 hours, cases had already crossed the border. 2 travelers from Congo landed in Kampala, Uganda, a capital city of 2 million people, and both tested positive. Over 1,000 cases have been reported across both countries. More than 130 people are dead. And this particular strain? No approved vaccine. No approved treatment. None. So how did we get here, and what exactly is this virus capable of? Ebola was first identified in 1976, near a river of the same name in what is now the Democratic Republic of Congo. It belongs to a family of viruses that look almost alien under a microscope, long, thread-like particles that hijack the human body from the inside out. The most deadly strain can kill up to 90% of everyone it infects. For context, the 1918 Spanish flu that killed 50 million people had a death rate of around 2%. The current outbreak is caused by a strain that kills between 25 and 50% of patients. And for this one, science has nothing ready. When the virus enters your body, it hides. It replicates. For anywhere between 2 and 21 days, you feel nothing. You go to work. You hug your children. You have no idea. In the first few days, it feels exactly like the flu. Doctors often miss it because it mimics malaria, typhoid, and dozens of other common illnesses. This is why outbreaks grow silently before anyone realizes what is happening. Then the virus attacks the lining of blood vessels throughout the entire body. Vessels weaken. The liver begins to fail. The kidneys follow. In the most severe cases, bleeding begins, from the eyes, from the gums, the body collapsing from the inside. Most patients who die do so from the complete shutdown of the cardiovascular system. It is one of the most aggressive viral deaths known to science. To care for an Ebola patient, a healthcare worker must spend up to 45 minutes just getting dressed. Every inch of skin covered. Hands gloved 3 layers deep. Because Ebola spreads through direct contact with bodily fluids, blood, sweat, vomit, saliva. In the 2014 to 2016 West African outbreak, over 500 healthcare workers were infected. More than 350 of them died. The people who ran toward the danger. Many became victims themselves. Between the first suspected case on April 25 and laboratory confirmation on May 14, 3 weeks passed. 20 days of silent spread. The virus moved through communities, crossed health zones, and reached a city of over 800,000 people before anyone knew what it was. And Eastern Congo is not just fighting Ebola. It is fighting armed conflict, mass displacement, and near-famine conditions. Nearly 10 million people in the affected region face acute hunger.
The WHO
Director General stood in the outbreak zone and said, "We cannot build community trust or isolate the sick while bombs are falling." That sentence tells you everything. Then came the moment that changed the global picture. 2 confirmed cases in Kampala, not a remote village, but an international capital with direct flights to every major hub on the planet. One American traveler tested positive. Health officials across the United States and Europe activated monitoring protocols. Because in a world of international travel, a virus in Kampala is not just Uganda's problem. We have been here before. The 2014 West Africa outbreak began as a single case in a small village. By the time the world responded, nearly 29,000 people were infected and more than 11,000 were dead. It was stopped, not by a vaccine, not by a treatment, but by thousands of contact tracers, community health workers, and burial teams. Sheer, exhausting human effort. Today, for the deadliest known strain, there is an approved vaccine and treatments that save lives when given early. But the 2026 outbreak is a different strain. No vaccine. No approved treatment. The best available option is supportive care, for fluids, managing fever, preventing secondary infections. Early intervention helps. But it requires hospitals and supplies and roads not controlled by armed militias. In Ituri province right now, none of those things are guaranteed. The risk to the general public outside Congo and Uganda is currently assessed as low. Ebola does not travel through the air. It requires direct contact with infected fluids. That makes it more containable than a respiratory virus, in theory. In practice, containment depends entirely on speed. Exit screening is active at airports. Neighboring countries are on high alert. But vigilance is not the same as certainty. In a world disconnected, distance is no longer protection. Ebola has emerged 17 times since 1976. 17 times it has appeared. And 17 times, through enormous sacrifice, it has been stopped. The nurses, the contact tracers, the lab technicians testing samples in remote clinics with unreliable power, they are the reason outbreaks end. Not headlines. People. But Ebola also reminds us that nature does not negotiate. That something invisible to the naked eye can outpace governments, overwhelm hospitals, and cross borders as easily as a passenger in a terminal. We have mapped the human genome. We have launched telescopes that see to the edge of the universe. And yet a virus with no brain, no intention, no agenda, can still bring an entire world to its knees. This is not a story from the past. As of this moment, it is an active, declared global emergency. And the next chapter is still being written.